I am nursing tutor in Index Nursing College. Today will be discussion about Parkinson's disease. Parkinson's disease. Parkinson's disease is named after James Parkinson, who in 1817 wrote a classic shaking palsy, a disease for which the reason is still unknown. Definition: it is a chronic degenerative disorder that primarily affects the neurons of the basal ganglia. It is a syndrome that consists of slowing down in the initiation and execution of movement, increased muscle tone, tremors, and impaired postural reflexes. Classification: post-encephalitic Parkinsonism, which occurred after the large epidemic of encephalitis in 1919. Drug-induced Parkinsonism occurring after long-term use of phenothiazines. Toxins include Parkinsonism, sometimes resulting from carbon monoxide, mercury, or manganese exposure. Exposure to agricultural herbicides and pesticides, trauma or injury to the midbrain. Etiology: heredity, antipsychotic drug, encephalitic infection in response to brain trauma, tumors, hydrocephalus or ischemia. Arteriosclerosis, neurotoxins such as cyanide, manganese, and carbon monoxide. Drug like reserpine, methyl-dopa, haloperidol, and phenothiazine. Pathophysiology: antipsychotic drugs, encephalitis, and other cause then affects the substantia nigra, then destruction of dopamine producing neurons within the basal ganglia, then reduce the amount of available striatal dopamine. That's called inhibitory effects. There is increase in acetylcholine, then excitatory activity is inadequately balanced, then difficulty in controlling and initiating voluntary movement. Clinical manifestations: in the beginning stages, mild tremor, slight limb, decreased arm swing, later shuffling, propulsive gait with the arm flexed, loss of postural reflexes, slight change in speech pattern. Classic clinical manifestations: tremors, first sign affects handwriting, non-intentional, present at rest but usually not during sleep. Movements of thumb across the palm gives a peel rolling character. Tremor also seen in limbs, jaw, lips, lower facial muscles and head. Rigidity. Second, increased resistance to passive motion when the limbs are moved through their range of motion. Muscles feel stiff and require increased efforts to move. Discomfort or pain may be perceived in muscles when rigidity is severe. Cogwheel rigidity refer to ratchet like rhythmic contraction of the muscle that occur when the limbs are passively stretched. Third, bradykinesia. We are saying akinesia. Slowness of active movement, difficulty in initiating movement, often the most disabling symptom, interfere with etiquette and predisposes patient to complication related to constipation, circulatory stasis, skin breakdown, and related complications of immobility. Fourth, postural instability. Changes in gait, tendency to walk forward on the toes with small shuffling steps. Once initiated, movement may accelerate almost to trot. Fascination may occur which propels the patient either forward or backward propulsively until falling is inevitable. Second, changes in balance. Stooped over posture when erect, arms are semi-flexed and do not swing with walking. Difficulty in maintaining balance and sitting erect, cannot right or brace self to prevent falling when balance is lost. Secondary manifestation, first facial appearance and second speech problem. So facial appearance, expressionless, eyes store straight ahead, blinking is much less frequent than normal. Second, speech problems, low volume, slurred and muffled, monotone, difficulty with starting speech and word finding. Third, visual problems, blurred vision, impaired upward gaze, blepharospasm, involuntary prolonged closing of the eyelids. Fourth, fine motor function, microphasia, handwriting progressively decrease in size, decreased manual dexterity, clumsiness and decreased coordinations, decreased capacity to complete ADL, freezing, sudden involuntary inability to initiate movement can occur during movement or inactivity. Fifth, autonomic disturbances, constipation, hypomotility, and prolonged gastric emptying, urinary frequency or hesitancy, orthostatics, hypotension, dizziness, fainting, and syncope. Dysphagia, neuromuscular in coordination. Drooling result from decreased swallowing. Oily skin, excessive perspiration. 6. Cognitive behavioral. Depression, slow responsiveness, memory deficit, visual spatial deficit, dementia. Pharmacological management, anticholinergics, antihistaminics, dopaminergics, dopamine agonists, monoamine oxidase inhibitors. Surgical treatment, thalamotomy. Thalamotomy is a surgical procedure used to treat tremor. It involves destroying a tiny area in a part of the brain called the thalamus. Pallidotomy. Pallidotomy is a neurosurgical procedure. It is used to treat Parkinson's disease and some other conditions, often as an alternative to deep brain stimulation. Fetal tissue transplantation. No cases resulted in completed reversal of Parkinsonism symptoms. Transplantation of genetically engineering cell lines or vector mediated gene transfection. Thank you.